that, why don't we go ahead and get started? Because I am excited to say welcome to the first Arrive at 5 for 2021. Last year was certainly the most unprecedented, the most unpredictable, the most unimaginable that any of us could have thought possible. So here we are at the start of a new year, and I hope it's going to be a year where we see a turn of events and that we can all hope to be back in person very soon. And I am so excited also to say we're sponsored tonight by Florence Bank, always Florence Bank. So we appreciate them for their sponsorship of this Arrive at 5. And this one is particularly exciting for several reasons. One, first of all, it's Black History Month. And I'm excited that it's Black History Month, and I'm excited to be a history maker because I am the first African-American executive director of the Greater Northampton Chamber of Commerce. And I hope you are as excited as I am to be proud of our community and the chamber for that. And I am having a blast being the executive director of the world's greatest chamber. So thank you all for your support and all that you do to support our community. And second of all, the 15th anniversary of the Northampton gift card programs is this month. So we are so excited about that, and you're gonna see us celebrate it in fun, quirky ways. So stay tuned as the year goes on. We're gonna celebrate all year long, and we hope to make sure that you're part of that. And thirdly, there's a lot of good news on the horizon about the vaccines that are being rolled out, and we couldn't be more fortunate this evening than to have our very own, for a short time, Joanne Marqusee from Cooley Dickinson Healthcare to give us an update and keep us all grounded in what's to come and what to expect and how we can continue to support each other and protect each other. And with that, I'm going to turn it over to representative of tonight's sponsor, Florence Bank, Monica Curhan, who is the Senior Vice President and Director of Marketing, who will introduce Joanne. So Monica, welcome and thank you. And it's all yours.
Great. Thanks, Vince. So as Vince said, I'm Monica Curhan. I'm the Senior Vice President and Director of Marketing at Florence Bank, and I have the distinct honor of introducing Joanne Marqusee, President and CEO of Cooley Dickinson Healthcare. Joanne joined Cooley Dickinson in 2014, following its affiliation with Mass General Hospital and the larger Mass General Brigham system as President and Chief Executive Officer. She previously held executive roles in healthcare systems in the Boston area, including serving as Executive Vice President and Chief Operating Officer at Hallmark Health System. Prior to joining Hallmark, Joanne was Senior Vice President, Operations at Harvard-affiliated Beth Israel Deaconess Medical Center. Earlier in her career, Joanne held positions in government, including the New York City Health and Hospitals Corp. And New York State Department of Health. Joanne earned a bachelor's degree in linguistics at Cornell University and a Master of Public Policy degree from Harvard University's Kennedy School of Government. Joanne recently announced, as Vince mentioned, that she'll be leaving Cooley Dickinson to become Executive Vice President, Chief Integration Officer at Wellforce, a healthcare system in Eastern Mass. Her last day at Cooley will be March 7th. During her tenure at Cooley Dickinson, Joanne oversaw the creation of a behavioral health pod in the emergency department, opening of the Mass General Cancer Center at Cooley Dickinson, and a new breast center, and substantial expansion in the provider practices across a range of locations and specialties. She led efforts promoting teamwork, quality, and transparency. She initiated diversity, equity, and inclusion work, starting with LGBTQ programs and more recently launching a comprehensive anti-racism plan. In addition, she was frequently spoken out on important public health policies and particularly those that affected marginalized communities. Joanne has been recently quoted as saying, "My 7 years at Cooley have been the highlight of my career." And before I turn things over to Joanne, I just wanted to say how much I enjoyed serving on the board at Cooley with Joanne at the helm. It was inspiring to witness her leadership. I saw her as always poised, calm, and confident. And I learned a lot from the thoughts she would share in her e-newsletters, appropriately titled On Joanne's Mind. Joanne, the Valley is really going to miss you.
Ooh, thank you. Thank you to the chamber. Thank you, Vince. Thank you, Monica. And thank you, Monica, for your years of service on the board. It was really terrific to have you. So I will start with the COVID vaccine update. I know it's top of everybody's mind. And just to go back in history a little bit, almost a year ago now, I think that when the first surge of COVID came out, it was a time where we really saw at Cooley the value of being part of this system of Mass General and Mass General Brigham. Things like knowing we would always get enough PPE, always knowing every day we would have whatever the latest best practices were, whether it was about infection control or how to treat people with COVID, which really was evolving at that time. There was so much unknown, and to know that we had these experts that we could rely on. And then the financial commitment that they helped us make to not furlough people during that first stage, despite the losses that we did have. So, it was really important to us. In terms of kind of where we are today, we've obviously gone through the first surge, and I think are at the tail end of the second surge, which has been the sort of winter months. The last few weeks at both Cooley, and it seems to reflect a trend across the state, the numbers have been down, and we look at that in two ways, both the number of people who are hospitalized with COVID, but also the number of positive tests that are happening at our drive-through. And both of those have come down. They're not as low as they were in the summer and early fall, which was kind of the happy time, but they're not as high as they were back in the early spring, nor as they were a couple months ago. So we hope that will be sustained. We need your help to do that. One of the things that really worries me is that with all the good news about the vaccine, that people will think that they can relax with the social distancing and the masking and the hand hygiene, and that's just not the case. As terrific as it is that this vaccine is so incredibly effective at 90 or 95%, that still means 1 out of 20 people who get it are not as protected. And you don't know who has it, who's been vaccinated, and they don't know yet how long it will last, and we're not sure about these other variants. So I don't say that to scare us. It obviously will be a much safer place when we all get vaccinated, but until the public health people tell us it's okay to stop wearing masks and to start living life, quote, normally, I would encourage you to not do anything less strict than you've been doing for the last several months to keep us all safe. In terms of the vaccine, it's been a very complicated process. I would say the lack of a national strategy from months ago on this has not been helpful, and the fact that there isn't enough vaccine to go around. So if you are frustrated and confused, that makes sense. It's pretty frustrating and confusing. We get a certain allocation of vaccine, our first, and we get very specific rules from the state about whom we can vaccinate. And the first phase of that was for healthcare workers. And we even had specific rules that we had to follow. That first, it was the healthcare workers who had direct face-to-face contact with people with COVID or likely to, and then had rolled out from there. At this point, all of our employees are eligible for the vaccine, and I'm really pleased to say that there has not been a lot of resistance to getting it. Most of our employees have gotten it. We can't be positive what percent, because somebody could be per diem or part-time with us, and it's very possible they got vaccinated at their other site. But our sense is that we know that I think it's over 90% of our employees are vaccinated, and so the others probably got vaccinated elsewhere. And then, as you know, as of a week ago, we started the vaccination program for patients, and that is limited to those who are 75 years or older. But importantly, the hospitals, including Cooley, are only one and a relatively small piece of the statewide effort to do vaccinations. So as you probably know, the Northampton Public Health Department, I think, has been one of the best throughout the state. And they have really been active and proactive and have a number of, have given out lots of vaccine, and UMass has a program. So what I tell people is that while usually we're like, just come to Cooley and get all your care, I would say if you have relatives who are eligible, get it wherever you can. Go on the website, sign up. If that's in Springfield, do that. If it's in Greenfield, if it's locally, then sign up one place and then see if something opens up more locally. We in fact will not have any new vaccine allocation for patients next week, so we won't be doing vaccines. And it's kind of a week-to-week thing, so we only schedule for what we know we have. But my sense is that the state is pivoting to having more of the public health system and the pharmacies to pick this up, which is really appropriate. I mean, it's, you know, we have a lot of work to do to care for our patients who need us, and it's not typically a role we play to do this massive public health program, but we obviously want to step in any way we can. So I would just keep looking at our website. We keep it up to date every day. We have a call center because the rules and the options are really changing day to day. But most importantly, I encourage, as soon as you're eligible, go look to get your vaccine, because it is definitely worth it. So let me turn away from COVID. It's nice to talk about something else. And talk about the Chamber. And, you know, the Chamber has been such a terrific partner for Cooley. We've been a member since the beginning, which predates me by many years. And I think if you think about the vision that the Chamber has for being creative and inclusive and caring and being really a stewardship of our community for everybody's benefit, we see that as incredibly consistent with our mission. And I want to say something to all the local businesses who are part of the Chamber and beyond. You know, we are really very acutely aware of how hard this pandemic has been on the business community, and therefore even more incredibly grateful and impressed by how much they have rallied around us. From day one of the pandemic, the local businesses and so many local residents went so out of their way to make our frontline staff know how much they were appreciated, whether it was just from amazing cards and social media messages to feeding our staff, to giving them gifts. It was just to making contributions. It was so meaningful. And, you know, it's been very hard emotionally on everybody. And, you know, healthcare workers have certainly taken a lot this year, and that support from the community, I just can't overstate how much that has meant on some of the toughest days when they sort of go home and they see that sign, "We love you, thank you, Cooley." It really makes a huge difference. So please know that it mattered. We also have tried to be as involved as we can in supporting others by with other local not-for-profit organizations to particularly support those who are really struggling during this time. So we had a real opportunity in December. We were so happy to get an anonymous gift for somebody who wanted to do something special for our staff. And given that we are definitely struggling financially, as all hospitals are right now, hopefully the stimulus dollars will increase, but they certainly haven't covered our losses so far. And the fact that we couldn't really have parties for Christmas, we were struggling with how do we really show our staff how much we appreciate them in a meaningful way. And so to have this donor come forward and give us money that we could use to give a gift out to all of our staff. So then we thought about, well, how, we could just put $50 in each person's paycheck and, that'd be nice, but it didn't feel like it reflected either our mission or how we were feeling about what we wanted to say to our community. And so we brainstormed and came up with this idea that what if we could work with all three chambers in our area, because we obviously have staff who live across a large geography, and have you all collaborate to create a gift card, which you all have individually, but one gift card that people could use at any of the chamber members throughout the three areas. And it was incredible, the reception we got when we called. And I think it was less than 24 hours. You guys were like, yep, we got it. We figured it out. We'll make it work. And then 2 weeks later, we sent out these new gift cards that were really wonderful, that said the 3 chamber names. And we have gotten such great feedback from the staff. They really were glad that it wasn't $50 in cash in their paycheck, but that this could be something they could give back to the community by really using those gift cards in our local businesses. So, you know, there's not a lot of times you can find these sort of win-win-wins, and this was definitely one of them. So thank you. And I hope you're all seeing some of our staff come by with those gift cards. So the topic of this meeting was public health and smart business. So I just did want to talk a little bit about that and recognize that Cooley doesn't act in a vacuum. Our mission is definitely more than responding to the patients when they show up at our doors. As the community hospital and the sole one in a pretty large region, we see our mission is to make our community as healthy as possible. And that is not something we can do alone. You may have heard a term called social determinants of health. So there are more things that determine whether people are healthy than just the healthcare provision services they get. You all know this: education, housing, food, transportation, jobs, broadband, digital access. So really, to carry out our mission of creating the most healthy community, we need to and want to partner with all of you to address those social determinants of health. And so that allows us to get better outcomes for our people and for the community, and also in the long run to be able to provide healthcare at a lower cost, which is in everybody's interest. We also try to carry out the mission to be a source of information and expertise. And that definitely came up a lot during COVID. There was almost too much information out there on the websites. And so to be able to sort of say, if you look at our website, if you call our call center, we will make sure you get the information that's really been scrubbed and really been reviewed by the experts, and that we are confident is accurate and up to date. And we want to more and more do that. I know that our chief medical officer, our infectious disease medical director, is also the city of Northampton's medical director, have been out at a lot of forums or been on Zoom calls with a lot of forums, local forums, to be that source of information. So we want to be that. We definitely see that as one of our roles. And then we also see our role in partnership with all of you, and particularly in partnership with the amazing array of community-based organizations, social service and health-related organizations here. It's to really focus on those who are most marginalized and are least likely to be able to take advantage of healthcare services, have the most challenging issues that affect their healthcare. And that's something that we do with you. And I think Monica mentioned the anti-racism plan, and we certainly have tried to really focus on LGBTQ since I got here. And all those things are things that, as all employers and all the organizations in the area, can really make a difference together. We can't do it alone. So I think it was really nice to hear Monica name some of the things I'm proud of. I would say that sure, all the programs, the breast center and the behavioral health center and our new outpatient sites in various areas are really important. But when I look back at what I hope I meant to this community and to Cooley, it's about the more cultural issues. And I don't mean, I'm not an opera lover, so I don't mean that kind of culture. I mean the culture of both the organization, how people treat each other here, how we are always looking to have better teamwork and communication, that we're transparent internally and externally, that you know that we're going to tell you what we do well, when we're struggling, when we could do better, that we want to hear from you. I've always said when I've gone out and spoken that please let us know when we have served you well and let us know when we haven't, so we can keep improving. And then I also really enjoyed, and I hope it made a difference, is trying to make sure we were tightly connected and leveraging the amazing community-based organizations in this town. I can't think of an area in another part of Massachusetts with the just wealth of creative, small, really effective organizations. And together, I always say 1 + 1 can equal 3. So in this case, it's 100 + 100 could equal 300. And then we are, continue to do all we can to leverage the Mass General relationship. No community hospital can do everything, and to have that incredible academic medical center behind us and be able to bring them their services here when needed and their expertise is really valuable. And then I've loved how much the community, or at least it seemed like the community, appreciated if I used my position as a bully pulpit to talk about social justice and diversity, equity, inclusion issues, and to feel that people were embracing that and that we were doing this work together. So just to end with kind of my plans and what it means for Cooley. So we have already, or Mass General and our board has already identified an interim CEO. His name is David Brown. And it's almost like you couldn't have created out of a recipe a better candidate. So David has been on the Cooley board since the MGH affiliation started, so since 2013. He's been incredibly helpful and supportive in that. Monica knows him. She can definitely, I think, speak to that. He is the head of the Mass General Emergency Room. So he's an emergency medicine physician. That's a very complicated and busy emergency room. Very well respected at Mass General and at Mass General Brigham. So I think he can do even more to make sure we're leveraging that. But I guess most importantly, well, maybe second most importantly, is he is an incredibly good guy. He has terrific integrity. He is honest. He's down to earth. He's not the typical Harvard professor. He doesn't have any arrogance, and he really cares about people, and he cares about this community. And finally, the thing that's really cool is, if that wasn't all enough, he grew up in Amherst. He spent his entire childhood in Amherst, and his father was a doctor at Cooley. So he has lots of memories of going to his father's practice. So the fact that, I'm the first one to say, as somebody who was a transplant from Eastern Mass, that people in Eastern Mass don't get us. Half of them don't even know where we are. So, that's the first thing. I have to show them the map. No, it's not next to New York State. That's not where we are. But David gets us, and he can, I think, be a really good bridge. So I'm really, really pleased that he's going to come. He's going to be part-time. He's still the chief of emergency medicine, but this is one place where us all being virtual a lot can help him. He is not a candidate for the position, and that was something they wanted, someone who was clearly here for the interim while they launch a national search. And so that search should start in the next few weeks. And they will be encouraged to have internal candidates, external candidates, candidates from Mass General, candidates from other hospitals around here. And there'll be a search committee that will include members of the board representing the community. So, there's nothing better as somebody leaving an organization than to know that we'll be in good hands. And I am sure that with the senior team that I have brought together, and they are incredibly talented, that this is the right time when I can move on, and I am comfortable at what the great job they'll do, and I know that David will support them. So I just want to sort of end with some personal comments. So I've been here 7 years, and that is actually for a CEO a very long time. So when people say, oh my God, there's so much turnover, it's not true. And it is, but I have loved this community. It was hard to come here, not really knowing people. I don't think I understood what it was like to relocate when you're perhaps a little more mature. But it is, you don't have your kids in school who introduce you to people and all of that. But this community was so warm, so inviting. Many of you on this screen I met early on, and just people like, whatever you need, we're here for you. And that could be as much as, we'll invite you to some event that therefore you can feel like you're part of the community. And that was so meaningful. And then this amazing level of collaboration, and you guys take it for granted because a lot of you haven't lived somewhere else. This is not normal. It is better, so much better than normal. In most places I've lived, you do not see all these organizations coming together and say, what can I do to help you? How can we do something together? What can we do creative? That is not always the case. And it just makes it so much more fun and so much more impactful. And I will miss that because I don't think it exists in the same way in Eastern Mass. Even the elected officials here get along. I mean, in Eastern Mass, you couldn't even get them in a room together. And here they're like joking around. I think I said that to Jeff Harness the first time we met with them. I was like, these guys all seem to like each other. That's amazing. So given all that, why am I leaving? So for a number of reasons. One, it was just, I felt like it was time. I have one more big job in me before hopefully I retire. And as much as I've loved it here, particularly after my husband passed away a couple years after I moved here, the sort of pull of my family and close friends I had for so long there, just every time I thought about it, I thought, I think that's where I'm supposed to be personally, and also better for my daughter who lives with me. And so it is really, really with so many mixed emotions that I go back there. I know it's the right thing for me, but I hope I can always feel like I'm an honorary member of this community. And as I think Monica quoted, it has been the highlight of my career, but also of my personal life. I thank you for everything you've done, and I wish you all incredible health and success. So thank you, and I'm happy to answer any questions. Thank you.
Thank you so much, Joanne. Thank you. I'm happy to help facilitate the Q&A session. So I would invite you to either, raise your virtual hand or send a chat, and we can move through questions. We have about 10 minutes to dedicate to questions for Joanne. Or if you simply just want to share your appreciation, that's just fine too. Mark has a question, and then John does. So why don't we start with Mark?
Thank you. I have a question about do you see the state moving towards more of a open enrollment of vaccines in the way they're proceeding now? It seems like it's kind of clunky right now and taking a lot longer than anticipated. It seems like I've heard of cases of, appointments being open and people not getting vaccines at different places. And if people were more available to go, it seems like we could get more people vaccinated quicker.
Yeah, it's a really good question. I think the governor is certainly feeling the pressure of a few pretty tough Boston Globe articles showing that the percent of vaccines that have actually been given out in Massachusetts is lower than most states. And not to defend him, because I do think the state has done some missteps in this, but they're correcting them. There is this tension or balance. You could get a ton of vaccine out very quickly if you worried not at all about prioritizing, right? If you just said anybody who can show up, come and we'll just have a long line and we'll vaccinate everybody. But who would show up? Probably younger people, people who are more educated, who have more access, who have cars, and the people who should be the first priority, who are most at risk of really being very sick if they get it, wouldn't. So it's this careful balance of trying to, and I think maybe the state overreached on let's really be strict on these prioritizing, and it's made the rollout slower. So I think they're going to start to relax that, but it really only can be solved if the state gets more vaccine from the federal government. Mm-hmm. So we need the manufacturers to make more. It's a little hard to understand why Massachusetts hasn't gotten more vaccine. It appears that there might have been some politics, shocking, behind that before January 21st. So hopefully that will get better, but there isn't enough in the whole country. So I think, that the new administration is doing what they can, but there's a lot of catch up. So yes, I think it will get better. Already the governor announced today some relaxing where if a 73-year-old brings a 75-year-old to the vaccination site, I think they're allowed to get it. And having more of these public health sites rather than, hospitals are not best set up for this. We don't have these huge areas to bring people in. So we're doing it after hours. We don't necessarily have staff we can just bring on board. So I think getting the CVSs and the Walmarts involved, and having more public health sites will help.
Thanks.
Danielle had a question about whether, Joanne, you have an idea about when the second phase of the second phase may start. For example, people under 75 with health conditions.
Oh, I hate to even take a guess, because literally I call my chief medical officer every 3 hours and say, so now what's the expectation? Now what's the plan? Because it just changes all the time. So as I mentioned, we aren't getting any more vaccine next week. So we couldn't go beyond the 75-year-olds even if we wanted to. Some places are starting to do that. It just sort of depends how much vaccine they have. I think it'll be in the next few weeks. And the next one will likely be, again, this could change, 65 plus and people with 2 or more comorbidities. So that will really help. Obviously, the nursing homes have already gotten it, and I think also to start getting to more frontline workers like teachers. But it's going to still be a few months before we start getting to the younger, healthier populations.
Jen Neary has a question for you, Joanne. She was hoping you could speak to the future of the hospital in collaboration with MGH. Are there any sneak previews for future development or collaboration?
So we're always kind of looking at how we can add more programs, take more advantage of Mass General. And I think what's now exciting is that we are starting to make more connections to the Brigham, because as Mass General, Brigham does more things really as a system. So that it just adds more options for what we can do. And then I think the telemedicine opens up a whole nother range of options where we can more easily offer second opinions, be able for people to get a little bit of attention from somebody in Boston without them having to come out here. We're looking at hopefully having some other subspecialists come. We already have high-risk maternity physicians from MGH. So these are the kinds of specialties that no community hospital would ever have. We don't have the volume to keep even somebody busy. But to have these incredibly world-famous people come here once a week, once every other week. And so we're looking at a couple of other programs like that. It's been a little stalled because of COVID, because not the time for people to come out, but we are doing more and more virtually. So I hope you'll see more of that. And the other exciting thing we did just launch in the last year is we now use the Brigham, and this is where being able to kind of see what the Brigham has that might not be at Mass General. They have a program, and I came from an academic medical center. This is really unusual. They have a program of people who do nothing but emergency department radiology. So it's a subspecialty. So these people spend their whole life not worrying about long-term things, but what do you need to see in the X-ray to fix you today? And so we now, because of technology, we use them for all of our emergency room radiology reads. And for our emergency room docs and PAs, they don't notice the difference between whether someone was 2 rooms away or 2 hours away. But they do notice that these people are so expert at this particular approach to radiology. So that's been a real improvement. I had our medical director of our emergency room tell me that he felt like he died and went to heaven, and that this will allow him to recruit emergency room physicians more easily, because it's so great as an emergency room doc to know that you have someone who speaks your language. So I think we'll look at other things as the technology allows us to take advantage of that.
That's great. Would anyone else like to ask a question or share a thought before we move on to our special surprise for Joanne?
There's one in the chat, Jess, I think.
Oh, yeah, great. Thank you, Vince. MJ had a question, Joanne. How are you working with local schools and workforce development agencies to create a pathway for careers for healthcare workers into Cooley Dickinson healthcare?
So it's a great question. This is an area where we really can't do it alone. And it is, I think I got quoted in the Gazette as when they asked me, what's your biggest concern for the future for Cooley? And I said, it's the same concern I have for all hospitals, the workforce. We already struggle. There aren't enough people who are working in healthcare, and as baby boomers start to retire, it's going to be a real problem. And we are seeing some troubling trends where where COVID is making people who might have otherwise gone into healthcare. So some people are jumping into it, like particularly public health, but a lot of the sort of entry level are saying, if I'm going to be a housekeeper, I'm not going to do it at a hospital, right? They're scared. So whether that'll be a long-term issue or for techs or any of those positions. So we already work a lot with the local colleges, but they also are constrained. So we have talked to all the local elected officials because this is an area that government really needs to get involved. Because we have to have bigger pipelines in order to create the opportunities for enough people to get through. There are young people who want to be nurses, but there are not enough slots for them. So I think it has to be at the state level, a major effort over the next 10 years. But in the meantime, we work very closely with GCC and a lot of the other local colleges. We actually have added 2 people to our board this year who are from, one is the president of GCC and the other is the head of the Institute for Health Professions, who train a bunch of nurses, et cetera, in Boston, because we feel like that's where we need more expertise. How can we creatively make sure that we're both have the pipeline, but then how can we also recruit people, promote people internally? And so we have a number of programs to take people, let's say a general med surg nurse, and train them to be an OR nurse and do that sort of on site. Find transporters who are interested in becoming radiology techs and things like that. But we'd love to work more with the chamber and others to figure out how we can do that.
I think we have one more question and just about time for that one more question. Ruth Briggs asked, how do you expect Dr. Brown to impact Cooley's ER?
I'm sure he'll have lots of opinions and ideas. I know he particularly has done a lot of work on, we have done a lot of work on reducing the amount of time people are in the ED. We're really proud of that, but there's still more work that can be done. People hate being in the ER for a long time. So I know he's excited to see how he can apply things he's learned at Mass General to that. And I think for our ER, which is so our front door, and we are just launching a huge campaign to raise money to be able to do a major renovation of the emergency department. His understanding it and being able to sort of be there for the docs and the staff there will make a big difference. And I think he can help the entire organization and the community really appreciate what an emergency room means and all the challenges they have. Now, I'm a little bit biased because my husband was an ER doc too, but I, in general, think ER docs have a particular, first of all, they're able to understand the whole system better than a lot of specialists because they have to interact with them all, right? They can't just do their job without relying on the inpatient and relying on radiology and their primary care docs. And they also have a particular passion for the underserved. People do not go into emergency medicine to get famous. It's not prestigious. People don't go to a hospital because Dr. Brown is the doctor there. And it tends to, and they also see the, some tough cases and people in very difficult situations. And so people who are emergency medicine docs have a special focus on social justice. So I think he'll bring that to the role as well.